Hi, kitty cats. I am Amethysta Herrick, your hostess for the Purplepaw, a weekly discussion from your friends down here at the Purplepaw clan, exploring the intersection of identity and gender, sexuality and intimacy, and community and spirituality. This content right here is being brought to you by supporters of the Purplepaw clan. If you are already a supporter, let me first thank you for your ongoing support. You know pretty dang well that subscribers not only receive new content directly to their inboxes as soon as it publishes, but are also able to interact with every contributor directly, which does include me. And I can't imagine why you wouldn't want to interact with me. So if you would like to support shows just like this one, as well as other podcasts, videos, and written articles by our contributors, I hope you will consider subscribing using the links you're going to find down there in the show notes. All right, I am super excited to be talking with my guest today, Eve Hall. Hello, Eve.
Hi there. How are you today?
Oh my gosh, so good. How about you?
I'm great. I'm so excited to have this conversation with you.
I know. This is going to be great. Eve is a physical therapist for sexual wellness and also like an award-winning podcaster. She is hostess of the Please Me podcast, and I appeared on that, which was kind of fun. What did I talk about? I think I talked about orgasms, huh?
I'm sure we covered that topic. Yes. You talked about your orgasms, which I was like, yes. Whoa, yeah, the change in orgasms.
Right. I remember that was such a fun show. Anyway, this podcast, I've got a few accolades to say here. So let's see. We've got the Latin Podcasting Fan Favorite Award at the Latin Podcast Awards. We have
It was actually the LGBTQ plus award.
Oh, okay. Thank you.
Yeah. Yes.
At the Women in Podcasting Awards, we have the Education Podcasters and Wellness Podcasters. And then just recently, finalists for Best Educator and Best Educator Website at the 2025 ASN Awards. Do you want me to keep going? Or do you want me to find more? So many.
That's enough for now.
No. Number one podcast and what was the subject? Number one podcast, I guess, in the
sexuality,
sexual wellness. Okay. Mm-hmm. Anyway, she's kind of a thing. She's kind of a big deal. So I'm so pleased to be talking with you, Eve.
Thank you so much. What an honor to be here. And thank you for bringing up all those awards. I've been working my ass off, for the last couple of years. And
I know.
Learning as much as I can. And, all of that pays off. So
it does. No, I've been watching the newsletter. I mean, every newsletter is like, oh, here's a bit more growth. Here's another cool thing. And by the way, I'm number one. And, it's like, it's great to watch. I'm so glad that it's really awesome to see you get everything that you deserve. I think I'm going to say it like that.
Thank you so much. I appreciate that.
Sure.
And thanks for subscribing to my newsletter. It's a lot of fun to put that out every week. And, there are usually things that come up on a weekly basis that I can talk about. So just things that are generally happening in my life. So, yeah.
Yes.
This last one, I talked about the DomCon conference that I just went to. So, yeah.
Right. It's a pretty awesome thing. All right. I'd love to start off. I always call this the origin story. I'd love to know, what happened, in your youth or at some point, something focused you on sexual health in particular. Can you just explain that? What got you focused on sexual health?
Yeah. So actually, I would say that it does start in my youth, but really then it sort of fast forwards to my divorce. So as a child, I was sexually abused by 5 people. And so that sort of started me off very early at 5 years old on a sexual journey. You know what I mean?
I'm sorry. At 5 years old?
Yes.
Oh.
Yes. So I spent my 20s. Yeah, I spent my 20s trying to work through that in therapy. I belonged to a community called SIA, which stood for Survivors of Incest Anonymous. It's very similar to like an AA program. It's a 12-step program, and there's just, a lot of questions and a lot of things that you can work through. I worked that program from beginning to end with another couple of ladies that I made friends with, and that are still to this day my besties. They're, even though we all live in separate states now, they're always going to be like so close to my heart. Anyway, so fast forward to finally feeling, like I wanted to get married. Before, I never wanted to. I never even wanted to have kids. And then, I think through my healing journey, that sort of changed. And I did end up getting married. And then 8 years later, got divorced. And so when I got divorced, I entered into the dating scene again. And that is where it was fun. And that's where my interest in sexuality and sexual health came to be. I had my own experiences. I, dabbled a lot in a lot of things that some people only dream about, and I came out on the other side, not only, sexually liberated in a way where I feel like all of that shame was sort of like washed away, but also bisexual, which I had never really explored before. And, which, was a beautiful discovery. So that's sort of my journey. And I'm a licensed physical therapist, and I actually was a pediatric physical therapist for the majority of my career. After I got divorced, I moved to Florida, and there were a lot of pediatric jobs. And so I started doing geriatrics, which is what you do in Florida, right? And then I started getting into pelvic health physical therapy, and I did some training in pelvic floor therapy, which is basically sexual health. Anything that revolves around the pelvic floor is sexual health related. And so I like to say that I'm a sexual health physical therapist. Most people that do what I do say that they're pelvic floor physical therapists, but like, who the hell knows what a pelvic floor is? It doesn't even...
Nobody does. Yeah.
No, but it's not like a bicep where people know what it is, or a pec. It's a pelvic floor. Like, people don't even... It's like a concept that people don't even grasp. So I think sexual health just makes much more sense. And it's also sexier.
Sounds so much cooler. Yeah.
Yes.
I mean, pelvic floor. So you teach Kegel exercises or something. No. Sexual health. That's what I do.
Yes.
Now you, since you brought up the pelvic floor, now I've got to ask too, because how does that relate to sexual health? I can see in women. I struggle to see that in men. So educate me, please.
Yeah. So when the pelvic floor is weak in a man, the man is not going to be able to hold the blood in the penis. The muscles actually hold the blood in the penis. And so you'll have venous leaking. And so the pelvic floor needs to be strong in men too. It's very important for sexual health. So I treat things like erectile dysfunction, premature ejaculation. Those are some of the conditions that I treat in men. Also fractured penis, if you've ever heard of that.
No. Wait. How
does one get fractured?
Go ahead. I'm just...
So usually from a blunt trauma, and typically it happens during sex. So if someone's
oh my God,
someone's like riding on
sure,
a penis and maybe misses the right angle, it can get a blunt force trauma, and what that causes is a fracture on usually one side of the penis, and then so you'll see when it heals, it starts to curve. So a lot of people that have curved penises actually have this condition.
Interesting. And so that, but that's because of a trauma to the erectile tissue, because it was a spongy erectile tissue that, oof.
Yes.
Wow.
Yes.
So much of me doesn't want to say this, just knowing my history, but actually I did have kind of a curve. And I was so glad to get rid of that thing. I was like, whew, now I don't have to look at that. I'm curious. I wasn't sure if that was just because I'm left-handed, because it went toward my left. And if that was, any indication of what I'm trying to say, the left hand was used for, self exploration. Let's just say that.
That's all good stuff.
Oh boy, yeah. But I'm glad we had this conversation so far. But so. Okay, so there was that. So what else? So with women, I brought up Kegel exercises, but I'm sure there's more to it.
So Kegel exercises are something that I would teach someone. I would teach someone. It's like tomato. It's something that I would teach someone if I knew that they had weakness in their pelvic floor. So those muscles can get weak. And also didn't have tension in their pelvic floor. If you have tension in your pelvic floor, you don't want to do Kegel exercises. You don't want to strengthen a muscle that is tight. For instance, if you have like a Charlie horse in your calf, right? You're not going to go do toe raises and like make it worse, right? So same goes with the pelvic floor. And a lot of people carry tension in their pelvic floor. And so it's a place that can get, muscle knots, if you will, like the ones that you would get in your shoulders, and they're very painful or whatever. You can get tension in your pelvic floor as well, because it is just an area where a lot of people tense up. And so, you have to do a full evaluation to decide what's going on with the person before you prescribe any kind of exercises.
Yeah.
So with women, some of the things that I would treat would be incontinence. Incontinence is something that's really common in women. I would treat decreased vaginal sensitivity and dryness. That's the female equivalent of erectile dysfunction. And so those are some of the conditions. Painful sex is also something that I would treat in my practice as well. So those are some ideas.
I've got to ask, how do you reduce tension in the pelvic floor? Because I got to imagine massage might be a bit, is it intimate? I'm not really, how do you address tension in the pelvic floor?
Yeah, you would put your hands in there and you would do some deep pressure. So it is hands-on. Sometimes also there's a lot of muscles that connect to muscles in our abdomen and maybe in our thigh or in our back.
Sure.
So depending on where you feel, because, each muscle is attached to a different part of the body. So looking for where those places are that they attach, they're called the insertion. You would, massage maybe externally as well, depending on what's going on internally. So hands-on therapy would be something that I would recommend for someone that had tension in their pelvic floor.
Yeah. Yeah. And I suppose maybe at the very beginning of this, you had said most people don't know what the pelvic floor is. I suppose we should probably define that. Sorry, now that we're 5 minutes into this, everybody, forgive me, but the pelvic floor, go ahead.
Yeah, so the pelvis, right, is the muscles of your skeleton that go around your genital area and your reproductive area, right? That's the pelvis. Your leg bones are connected to your pelvis bones.
Beautiful.
And so the skeleton is held together by muscles, and it's like a cup, sort of, right? The pelvis. And at the very bottom of the pelvis is all of these different muscles that hold it together, and that support your bladder and support your organs in that area, support your reproductive organs. So the pelvic floor is very important to hold all of that in place. And oftentimes, if that gets weak, you can have prolapse of your uterus, you can have prolapse of your bladder. So it's really important to have all of those muscles be strong and holding everything where it's supposed to be.
Yeah. A thought occurred to me too. So in gender-affirming surgery, so for transgender women, gender-affirming surgery, assuming you get a neovaginal canal, they do actually, penetrate. I'm trying to think what the word I want to use, but they will cut, a hole in the pelvic floor for the neovaginal canal to go through.
For it to be longer.
Yes. Right, because you can go basically from the very outside of the skin there up to your peritoneum. I'm doing something like this, but it's usually, doesn't generally go over about 13 centimeters. which in like freedom units is what? Not quite 6 inches. It's about 6 inches. So where I'm going with this, though, is to say that have you worked with a transgender woman on reestablishing pelvic floor strength? Because part of the reason I didn't get a neovaginal canal was exactly that. They were like, oh, well, it goes through the pelvic floor. And I was like, sorry, what? Because I was long distance runner. You care about pelvic floor strength in when you're a distance runner, right? So I was like, okay, thank you. I'll get a minimal depth. But so have you worked with transgender women on that?
I haven't yet, but I am looking at getting some certifications specifically for that population because I want to work with that population, definitely.
Yeah.
So I have not as of yet, but it will eventually happen.
Mm-hmm.
Yeah.
Yeah, because I've really wondered, cutting the pelvic floor, cutting the muscles in the pelvic floor. Yeah. So, okay. Well, thank you on that. And thank you for my little foray into science. If anybody got bored, you can come back in now.
I think we talked too about the reason why, though, is because you were not that into penetration, right? So it wasn't as important to you.
Right.
Yeah.
Right.
So if that's the case, why damage your pelvic floor? Now, if you want deep penetration, then that would be something that you would consider as part of your surgical procedure. But because you weren't interested in that, Yeah.
Well, an interesting. So when I've spoken to surgeons about this, and as a reminder, so I'm actually like a registered agent for a surgeon in Thailand, actually for a hospital, I suppose, to discuss these surgeries.
Mm-hmm.
When they take everything off, on the outside, and pull it all together, no matter what you do, end up with a little bit of a canal. Like I've got a little place that I can, poke a finger in. I haven't tried playing with it much, but there's a little place where you can put something in. And without a neovaginal canal, without like specifically reconstructed canal, you can get, they were saying up to 5 centimeters. So a couple of inches, right? At this point, I have to do math. Yeah, 2 inches, about 2 inches. So you stick anywhere from 5 to 7, they said. So I'm like, well, wait a minute. So you only get maybe another 5 or 6 centimeters max from that? I'm like, I could really sort of put something inside me anyway, and why should I bother? Anyway, if you've got
you could probably train that because you would have to be fully healed, but I have a penis extender that basically does that. It extends the penis, it holds it in that position, and then mitosis happens, creating more cells, and then over time, it gets longer. So I think that if you were into penetration and you used something to penetrate you on a regular basis, you could probably extend that over time. Not obviously all at once. It would take time. But even using like a penis, or not a penis, a spacer, that's another thing that we use for painful sex. But even using like a spacer in there to like gradually graduate to the next bigger size or whatever could possibly even work too. So that's interesting. But since you're not into it, I can't believe that you don't at least, those 2 little inches, you're not playing with those 2 little inches. You should be playing with them. I want to know if they have good sensation or not.
It's a good question. Well, so also from what I understand, and of course I have no idea what happened with mine because it's not like I can exactly look, but from what I understand, they also bring the prostate gland forward, I guess. So I guess anterior, right? Is that the right word? Right toward the front of the body.
Anterior. Yes,
okay.
that's correct. Yes.
So they bring it forward so that it's close to this, ultimately what all comes together that they draw up inside, so that if you penetrate something in there, you actually get a so it can actually touch the prostate gland and do a little bit of stimulation. I don't know how much, because for what it's worth, again, I don't know what it's like to play with a prostate gland. this is, I can't believe I'm making these confessions like in the middle of this, but here we go. I know, I'm all flustered now. Plus my phone starts ringing, right? I mean, come on. Right in the middle of this story. I'm like,
Someone's messaging you or calling you saying, stop talking right now. Stop talking right now.
I know, that's what it is.
But the Skene's gland is the female equivalent of the male prostate, and that is what causes female ejaculation. That's where female ejaculate comes from, the Skene's gland. So it actually is a very sensitive part of the female anatomy. So moving that to a place where the Skene's gland would be, it would make sense that you could have some pleasure in that space as well.
Right. So the surgeon told me, anyway, the surgeon's like, you could dilate this. You really can dilate this. And was saying originally just, you could start off with finger dilation. And if you wanted to do more, you could get like dedicated, because, when you do get a vaginoplasty with a canal, they do give you dilators. So like, a few different sizes that you have to continue inserting inside you. Mm-hmm. So the guy said, you could totally do this if you wanted to. And I said, oh, I'll think about it. I have not done more than maybe like a finger joint. And I'm just going to say that. Just maybe a finger joint. And I was like, okay, I mean, there's a hole there. That's, kind of interesting. So I am feeling so embarrassed right now. And I don't know why.
Well, I don't know. I tend to have that effect on people where they start confessing things, but honestly, there's no shame in any of what you're saying. And I want you to explore all of the pleasure that you have available to you. That's what I'm saying. I feel like, when people listen to my show, I really want them to like throw that shame out the window and really like, go for it and be like, hey, I am going to figure out what pleases me. I'm going to have the best sex life of my life, and I think we all deserve that. It is, our bodies are meant for pleasure. And if you are ignoring that part of yourself, you're missing a huge part of life. So I want you to explore all of the nooks and crannies, I mean, if you're interested, obviously.
No, of course. Well, I think you and I have talked long enough to know that I'm not exactly inhibited. Maybe that's the word I'll use. So it is kind of weird that that I'm like, ooh, why am I feeling so embarrassed about this? You know what, though? I'd love to go off on that little bit of a tangent. I think it is often, you mentioned shame. You used the actual word shame. I think that is common when somebody goes, oh, what are you into? What kind of sex acts are you into? I think a lot of people go, ooh, no, I'm not going to tell you because I'm ashamed. Presumably you see this all the time, but like, what is all that? I think I'll just put a question mark there and let it go. What is all that?
And this is another reason why I started my podcast, was because I would have patients come to me and say, hey, I'm here for my, incontinence, say a woman, but my husband doesn't know I'm here, or I'm here for my erectile dysfunction treatment, but my wife doesn't know I'm here. And I'm like, how do you not tell your own partner that you're married to that you're not, like, that you're having issues? Like, there's just even shame around sharing that. In a relationship, which is so sad because, your partner wants to pleasure you, wants to make sure that you're happy, is going to support you in getting any issues fixed or, improved. So it's sad that people are not having these conversations, even in long-term relationships or marriages. And so, that's another reason why I started the show, to really destigmatize these conversations. And, what is it? It's society, it's religion, it's friends, it's, our monogamous patriarchal society that we live in that, we can go off on a whole nother conversation in that direction,
Right.
But that is where all of that shame comes from. And when you realize the systems that are systematically trying to keep you down, and to shame you for being a human being and being in your body and embodied and okay with and wanting pleasure. There's nothing wrong with that, And so, so I think that throwing that shame away is so key to moving forward with your sexual exploration. You have to be able to kind of disconnect from it, realize where it's coming from, and then say, okay, I see you. You no longer serve me. Goodbye. Then you can really sort of explore.
I agree with that. Like 100%. What's interesting to me too, and I'm not even sure how much I want to go into this, but I'm going to throw it out there. I have seen a bajillion, advertisements for erectile dysfunction. We have 60,000 different prescriptions you can get for erectile dysfunction. Nobody cares about women's incontinence. Right, and it was a fascinating thing that it's like, well, I don't know. Let's care about the person with the penis here. Let's make a bunch of prescriptions, and yet nobody cares about the women. I don't know if I had anywhere else I was going to go with that, but go ahead.
Again, the patriarchal society that we live in.
Yes.
I mean, all of the, a lot of the studies are done on men's bodies, not on women's bodies, and then we're supposed to take the same medicine as the man does because it affected them in this way.
Right,
but how do we know how it's going to affect us if we have not done any studies? So absolutely, there's so much more to learn and do in terms of women's health. But I will say that I just interviewed someone from the Shameless Care company. I don't know if you've met him before, Robert Johnson.
No.
Well, he's incredible, and he created this company where you can get at-home STI testing, and and it includes a doctor, that reviews everything, that will prescribe the medication that you need if you have anything wrong with you, and then also he has a whole host of medications that he offers as well, and several of them are for women. There's a Viagra for women. There's a Cialis for women.
Wow.
And they're accompanied with or without oxytocin. And oxytocin is that that hormone that helps us to feel connected. So it's really great for like people that have issues with libido and, want to kind of get their mojo back. I mean, just like a whole host of different options for women, which I was like, thank you for someone paying attention to our pleasure, because yes, women have decreased vaginal sensitivity and dryness, which is the same condition as erectile dysfunction. People don't realize that we have the same thing, and we need blood flow too. And if we don't get the blood flow, we're going to stay dry. And so this can really help to increase the blood flow, because when the blood is happening in that area, it seeps through the walls of the vagina and it causes wetness. And that's how we get wetness. So if we have decreased blood flow, just like the man would in erectile dysfunction, we also have a loss of function.
I got to tell you, I didn't know that.
Yeah.
I didn't know that was just from blood flow. I don't want to say just, because I've actually, I've seen like topical application of estradiol. It's like gel, like an estradiol gel that's used to put, you put around the vagina, and it helps with dryness. Is it because that? There you go.
Here's mine.
There you go.
So, this is Parlor Games. This is the company that I use myself. Okay. And their estrogen cream is called Silky Peach Cream. And basically, estrogen is so essential for female health. Estrogen is important. It's an important hormone, right? And as we age, our hormone levels decrease. So that's normal, but it's not optimal. So as our, hormones start to tank, we need that estrogen, because the estrogen is almost like a link of a fence. If you think of your skin as a fence, and in those links are estrogen receptors. And if they're empty because you have no estrogen anymore, or you have low estrogen, that linked fence is going to be weak. And when you have weak links of a fence, that being your skin is going to be papery thin. It might have micro tears, and it's going to be extremely painful to have sex. And in addition, you might have incontinence. You might have vaginal atrophy, which happens with men and women and anybody. Really, all of that can atrophy. It's muscles, so it can atrophy if you're not using it.
Oh.
So you have to use the tissue in order for it to stay healthy. But estrogen is very, very important.
Yeah. Thank you. Wow, I'm learning all kinds of awesome things. And as long as we're talking about it, because I love learning just in general. And I think it's interesting. You see, like, the perpetuation of the human species. I don't know who talks like that other than me. The perpetuation of the human species. Whatever.
You're a scientist. It's all good. I'm a sapien.
That was pretty clinical.
That shit. I love that shit.
that was pretty clinical sounding, but it does. If we don't have sex, we don't have pregnancies, and we don't have more children. So what I say, the perpetuation of the human species literally depends on us, like, understanding this, and yet we don't. Well, how do we? Well, I didn't. I'm thinking I'm pretty well versed in this, and now all this stuff you're telling me about the pelvic floor and the role of estrogen, in some of these processes. What do we have to do to get better education? Yeah, question mark again, across the board, because I was going to say for kids, but I'm not a kid.
I feel like, yeah, exactly. I feel like the perpetuation of the human species is going to happen because people like to fuck. Okay?
Well, they do.
And so I think that, I wouldn't worry about the human species disappearing by not knowing about the role of estrogen, because that really comes into play either after a pregnancy or when you're in menopause or perimenopause. So at that point, you're trying to salvage your parts and keep them functioning so that you can enjoy the pleasure that they offer, not the pregnancy part. So I feel like, we have, innate desires for sexual activity.
Innate mechanisms for perpetuation of the human species.
Yeah, animals do. I think that's a very animalistic thing. But certainly education helps if you want to keep those parts functioning until your 70s, 80s, and 90s, enjoying sex all the way until you die, which is what I'm rooting for myself.
Shooting to do, yeah.
Or shooting for, I should say.
Yeah. No, I think it's a great idea. So much of me wants to ask this question, and then so much of me goes, you know what, we probably have better things to talk about. Is erectile dysfunction you mentioned it's because the pelvic floor is weak, and so the blood can't stay in there?
There's different reasons why someone would have erectile dysfunction. That's one of the reasons would be like that the pelvic floor is weak and that the blood is not being held in the penis. So sometimes the penis can get hard, right? But then it doesn't last that long because you have venous leaking, because the pelvic floor isn't holding it in place. So in that case, you need strengthening. A lot of times it's because there's blockages in the blood vessels in and around the penis. And those blockages, just like a heart blockage, right, can cause a decrease in blood flow. And so because those blood vessels are so small comparing to the heart, they block up faster than the heart would. So it's a precursor to heart issues. So there's a treatment that I do called acoustic wave therapy, and that actually is a treatment that breaks up the little blockages in the blood vessels in and around the genitals, and it helps for those blockages to flow away safely. And then over time, when you get multiple treatments, it also helps to increase capillary formation, and capillaries are the teeny tiny blood vessels that go to all of the cells in your body. So you need those for blood flow. So it creates more capillaries and it breaks up the blockages. And so it's a very amazing gold standard treatment for treatment of erectile dysfunction if you have the physical form of erectile dysfunction. And a lot of times people that have the physical form also have the psychological form because it gives you like, it makes you feel bad that you can't get it up. And so you start having, you just start getting worried about the fact that you can't perform. And so that can also affect your sexual health as well.
Okay. Because I would assume then, well, let me ask the question, because I see medications, and if we're talking about blockages in blood flow, like I would not imagine, and maybe I'm wrong, that just taking a pill would do that. Is that that affects a psychological issue then?
So what the pills do, and you're talking about Viagra and Cialis, right, is it opens up
I guess.
the blood vessels. So if you have a blockage on this side here, and it's like a little blockage, but it's blocking it, and then you open it up, well, it's going to flow around that blockage. So it doesn't treat the actual problem.
Sure.
It only, at that moment, opens the blood vessels up and allows the blood to flow. Now, if you over time have a very bad diet and your blockages become worse and worse, that medication will eventually stop working for you, and you've done nothing to treat it for however many years. Instead of doing something to treat it, you've just been putting a Band-Aid on it. And that's, that's Western medicine. Unfortunately, we love a quick fix, right? But if you want to get to the bottom of the problem, you need to look at it holistically and look at what is causing the issue.
Thank you for that. It's a bummer that's just a crappy vasodilator. Like you could just get like ephedrine, basically. Yeah, I think it was ephedrine was one. Take a Sudafed instead.
Or do the watermelon challenge. I always tell people to do the watermelon challenge. It's a thing that I recommend. I created it myself. It's a week-long challenge where you have either 4 cups of the red watermelon or 1 cup of the yellow, because it has 4 times the amount of citrulline. And citrulline is basically a natural Viagra, and it opens up the blood vessels. So if you are using that on a daily basis for an entire week, you are going to see an increase in function of blood flow, and you will have harder erections and also more wetness down there. So it can be used for women as well.
I've never. This is a new thing too. How come is that on your website? How did I miss that? The watermelon thing.
I've definitely brought it up in many different webinars and podcasts, and I don't know if it's on my website, but it's definitely all over my podcast.
Right. I'm amazed that I didn't see that before, because I think that would be would have been something that I would look at and go, oh, that's cool. Like, that's really cool.
And it's natural. And, whenever, you can do something naturally instead of taking medication, obviously try that first.
Yeah, absolutely. Absolutely. How much time do we have? Ooh, we got a lot. We've talked about, I'm trying to figure out how I want to back into this particular topic. We've talked about partners, like, to a certain extent, we've talked about people with partners. How much self-exploration do you recommend? I don't know if that's the best word to use for that, but I think you get where I'm going. How much of that do you recommend people do to improve their relationships with partners, or even just with themselves?
I think having your own sexual practice with yourself is so important, whether you are in a relationship or not. And when you enter a new relationship, you should not be giving up your sexual exploration with yourself. It's very, very important. And if you're talking about just function, right? And if you're having maybe sex like once or twice a week in a relationship, what about the other days that you're not actually using the parts? You have to use the parts or you will lose them. So it's very important to masturbate. I think it's essential, actually. And when patients come to me, it's part of the homework that I give them. And I tell them to masturbate on a daily basis, and specifically for men to ejaculate as well. And a lot of times people will say, oh, well, I want to save it for my next time. Why? I don't get that. I mean, that's a guy thing, I think. And I just don't understand, because I don't like that. But some people love it. But the bottom line is, you have to ejaculate. You have to practice the whole entire experience in order to stay healthy. And if men were to ejaculate 21 times or more per month, it decreases the risk of prostate cancer. So that's for men.
Sure.
For women,
Right. It would.
yes. And for women, it's very important to masturbate too, because like I said before, if you don't use the muscles, they atrophy. And if you get atrophy, you can get, vaginal atrophy, which can cause painful sex and all sorts of other issues. So it's important to use the parts. Just like you go to the gym and you work out, it's important to work those muscles out too.
I'm sold. In fact, I think as soon as we're done.
There you go. There you go.
I saw, it was the rose, I saw on your website, there was a rose thing that I was like, oh, that looks interesting.
I love
do you know
my
the one it
rose.
was, okay, so you do know
talking about
exactly the one I'm talking about.
The one that's like a gag, a ball gag?
Oh no, I'm sorry. It was a clitoral stimulator.
It was just like a vibrator.
Yeah.
I
did see the ball gag, by the way.
You did? Isn't that pretty? I think that's such a beautiful ball
it was
gag.
Pretty cute.
Not that I would ever want to gag myself, but I don't know. I might gag someone else.
But other people, it's fine. Yeah, I mean, other people are fine.
Exactly. And I love that one. It's just so beautiful. But yeah, the rose, I love the rose, and I'm going to tell you why. And it is my favorite vibrator. I just actually bought another one. I've had a number of roses. And the reason why, because, they break or whatever. I mean,
sure.
I use them on a regular. Yeah. So the rose has a big surface area. And so it covers more of the clitoral area, more of the sensitive tissue. So sometimes vibrators are pointy or whatever, and they'll cover a little area. Well, the rose has a big surface area on the top. It also has a sucking action, which not all roses have. Some of them are knockoffs and they don't have that. But the original one has a sucking action, and you can put it directly over your clitoris if you like that sensation. You can use it on your nipples, or if you don't like the sensation, you can kind of move it away, the sucking part, and just use the whole surface area to give yourself a lot of stimulation. And they're amazing. I love them. I
saw that and I was like, I might need to try that out because because I'm not sure. The only thing I've got is I have this little finger that it's got a little hooks to your finger sort of thing.
Right.
Very, very small, kind of it's like a hard plastic, but it hooks to your finger so I can,
I think it's time for you to go shopping and treat yourself to some fun toys.
I mean, it certainly is. Interestingly, I'm not embarrassed talking about this. It just sort of struck me that talking about, putting, inserting a finger, that was a bit weird. But talking about, vibrators, that's 100% fine. I'm like, that's cool, yeah.
Isn't that interesting?
It is kind of weird.
Interesting. No, it's super.
I'm a bit odd, but we've talked enough, I think, that you've known.
We talked a lot about orgasms.
Yes.
So
I'm thinking about it. I saw that and I went, you said it was your favorite. So I'm like, oh, okay. Well, that says something. Anyway, I'm trying to figure out now how to back out of this.
I think you need to just buy yourself one and be done with it.
I think so. No, I think so. Because I do the thing is that I can't believe I'm talking about this. Okay, now I may be feeling a little bit ashamed, but the little thing with the on my finger works because I don't have to move much. It vibrates, right? And so I don't have to move much, which is nice because I'm sort of hey, I'm just lying here. I'm going to tell you too, one of the best parts, that's not the word I wanted to use, but one of the best results of gender-affirming surgery is the stimulation so much easier, I think I'm going to say. So much easier.
You said that your orgasms were better and more full body. I mean,
so much.
That's so amazing to me. I just find that fascinating.
There's, I think there is a biochemical aspect to that. As you change the dominant sex hormone in your body, a lot of biochemistry changes, including, as it turns out, nerve transmission. I'm trying to come up with a better word for that, and I'm not. But estrogen dominant bodies tend to be better at suppressing pain because the nerves, you get more sensitivity in the nerves, and I don't know, your body's able to handle some of these things. Why? I don't know. It's, because we don't study this kind of shit, right? We're like, why? How can women, stand pain better than men? Who knows? Who cares? Anyway, send everybody off to war and it'll be fine. I'm glad I'm not bitter about this too. But the point was going to be that, I think the changing the hormone, the dominant sex hormone, you got it, made a big difference there. Because even prior to surgery, it was very different. Anyway, now I just got a little finger thing, and it's a lot of fun. But I'm really open.
I wonder if there have been more growth in your nerves, in that area too. Like, who knows, with maybe the
could be
hormones. I don't know. I would love to do a little research on that. That's super interesting. Because your experience kind of blew me away. I was like, wow, your orgasms are so much better now than they were before. That's just amazing to me. I think that would be my biggest fear, would be losing function, and losing sensation. And that was not the case for you. So I think that is really unbelievable and amazing. And oh my God, exactly what you needed. You know what I mean? To like say, hey, because women have more orgasms than, we can have multiple orgasms. Not that we have more orgasms. That's not true.
It's a beautiful thing.
Yeah, but we have more sensitivity, right? We have more nervous tissue, more nervous cells, more receptors, pleasure receptors, than men do. So I think it's interesting. I'm wondering if, by adding the hormones, that it actually helped the sensation to become stronger, or maybe even more nerve creation. Who knows? It's fascinating.
That's a good question.
Mm-hmm.
I wonder, because it's improved over. I don't remember when we spoke. I think we spoke, it was maybe last September or October. So it's about a year ago.
It was soon after your surgery. Yeah.
It was pretty soon after. Yeah.
Yeah.
And it's only gotten better. Things have only gotten, they just feel more integrated, I think is the word I'd want to use. So maybe you have something there that it has improved. It's either grown new nerves or just better nerve transmission. I don't know. But anyway, all this came from the rose, and I will.
It's a beautiful
we'll buy a rose. Try it out. Yes, sounds like it. So you too, if you're out there, we'll go buy a rose. And you can buy it on Eve's website as well. Do you have is that like an affiliate link? I hope.
Pleaseme.online. Yeah. My whole entire store is an affiliate through Organic Lovin', which is
cool.
a sex toy store that I love. And the person who runs that company, her name is Taylor Sparks, and she is a sex goddess. And I've had her on my show a couple of times, and she helps me to curate my store. And so all of those are from my affiliate through her company. But I have a whole store. I have an entire store of things that I thought were hot. So there's also a dildo that's like a rainbow dildo, which I thought was really cute.
That. Yes, I saw that. I went through every section last night.
You did?
Originally, I was just looking for your story, but I was like, oh, store, what could be in this store here? And I'm like, what could be in this section? Well, what could be in this section? Well, what could be in this section? And I'm like, that looks cool. And I know I had 6 or 8 tabs open because I'm like, I want to look at all the good things, but
there's a whole kink section, which I think is so fun. Yeah.
Yeah. My friend and I sent her the link because we were joking about, I don't even know how we got on it, but we were joking about furries. Oh, I do know. She said she had seen, it wasn't joking, by the way, if you're furry, sorry. Because she said that she saw people walking around like a university campus with tails. And then she goes, and I never really knew how they were connected, And I said, I have seen, things you insert that have a tail on them. I've seen it.
Yeah, there's butt plugs. There's butt plugs.
Yes.
Tails for sure.
Right. You have a My Little Pony. I think it says the My Little Pony butt plug. And I was like, oh my gosh. So I sent it off to my friend. I'm like, you see, I told you. They do this.
I had a furry on my show, actually.
Oh, wow.
And yeah, he was really an interesting guest, Jake Dudinsky. And so
I
know
talked to him. Yes, he was a great guy.
Yeah.
I loved him.
So he's a furry, and he was on my show. We talked about that. And actually, just at DomCon, which is where I was last week, on my vacation, people go to islands and go relax, and I go to a dominatrix conference as my vacation, right? And so there was a whole awards for furry play. They had a whole awards ceremony, and I didn't go to the awards because I don't really partake in that world, but I'm curious about it. I'm definitely curious about what the awards were and how they were, divvying the awards out, what the categories were and all of that. But that was really super interesting too. That's a whole separate section of kink that I have not explored myself. I do like a good butt plug, but I don't have any with the tail on them.
Maybe the time has come, as it were.
I didn't think I would maybe not mind a little bunny tail. That'd be kind of cute.
Oh, that would be adorable. That would be so cute. It would be cute. I would think a little cat tail. I would love a little cat tail is what I'm thinking. Because everything's cat here, presumably you noticed.
I love
everything's
cats too. I love
Good.
cats too.
I actually, let me wrest the conversation away from that, because it would just keep going because I'm doing it. We talked about self-exploration, so masturbation. So does this? I'm trying to figure out how I want to ask this question, because does this help us understand how we work so that we can communicate it to a partner? Because here's the reason I'm asking this question. Really, I'm asking for a friend.
I love asking those questions.
I know, right? Because I understand what it feels like for me to touch myself, but it's totally different for somebody else to touch me. Mm-hmm. And something that I would do to touch myself is still maybe I wouldn't want that even with a partner. So how does self-exploration play into that with a partner even?
I think it's essential for knowing what you like, because you want to be able to translate that information to the bedroom. With your partner or partners. If you don't know what you like, it's going to be really hard to get there on your own, or with a partner, I should say. You have to be able to masturbate and get to climax on your own in order to translate that information to the bedroom. So masturbating is not just about self-pleasure. It's also about learning what you like and then communicating that. And the communication part is the hard part. A lot of people are not comfortable having these conversations, and so we have to learn to do that. It's a skill just like any other. And, as time goes on, it gets easier and easier. So, the first conversation is always oh my gosh, I want to tell you about something. And then after a while, you're hey, go grab the whatever it may be that you want, I need that today, or, bring the sex machine out. I need that tonight, whatever it may be. So you get better at having these conversations, but at first it's very difficult.
Yeah. Do you think it's ever bad to talk about something sexy with a partner? Is there ever a time when it could be bad to have that communication, that conversation? Let me say that.
No.
Okay. It was a pretty quick. It was kind of my guess.
Never bad. But obviously, you have to choose the right time and place. Obviously, you're not going to be sitting around a dinner table with your whole family and be hey, I wanted to talk to you about XYZ, sex related. There's a time and place for everything, obviously, but I think that if there's something that you want to share with your partner, a desire, a fantasy, I think it's a turn on. It's so important to share these things with your partner, because how else will you expand in your sexual knowledge and your pleasure? And I think that a lot of people don't experience the amount of pleasure that they actually can physically experience because they're afraid to have these conversations. And so
Right.
if you want to explore all of the pleasure that your body has at its disposal, then you have to be able to communicate. And, this is what grownups do. We have conversations, and yes, it's hard at first, but eventually it gets easier.
I mean, I get your point. At least make it appropriate. Maybe not when you're doing taxes or something. Like, actually, maybe that's a good time, because you're
That's
like,
exactly when I would want to do that.
right. You're like, boy, this sucks.
Let's change this whole energy right now.
Right. I don't really care about the 540 form. Can we just? Have you seen the new My Little Pony butt plug on Eve's website? Well, pull it up. See? Good work.
There you go. Yeah. Like what does turn your partner on? Do you know that?
Yeah.
Answer.
Yes.
You know the answer to that
that's
question.
a good question.
Yeah.
That's a good question. Yeah, I've spoken with people about fantasy, and it's such a, I was going to say sticky topic, which doesn't sound, it kind of is a sticky topic in many ways. Because I think a lot of us, we kind of go, ooh, I don't want to tell somebody because somebody else is going to go, I'm sorry, what? No. That's always my assumption.
Or they might say, ooh, that sounds really hot.
Do you know what's stupid is that's always been the case. Anytime I have said,
we are so fearful. We always think the worst, right? They're going to think I'm crazy. Yeah. They're going to think I'm like a nympho or whatever that may be.
Right.
Everyone's sexual. We're all living in sexual bodies. So, it's rare to find someone that's asexual, So if you're with a partner and you have sex with them, they're sexual too. So,
True.
Don't always think the worst.
It's a good point. And it was not until literally right then when you said maybe they'll think it's hot. And I thought, I don't think there's ever been anything that I've said that somebody didn't go, yeah, okay. I mean, let's give it a shot.
There you go. You see?
Well, we like to second guess ourselves, right? This is the human condition, I think.
True. That is true.
All right. So now we are, unfortunately, I think we are running a little low on time. I know that there is going to be some, first of all, it's, you have a store on your website, but I also, so let's just tell you, geez, let me try this again. How do we find Eve Hall on the internet?
Yes, you can
Quick
find
way
me
to say
on,
that, but.
Yeah, no problem. You can find me on pleaseme.online. And I also offer 15-minute discovery calls if anyone is interested in talking about your sexual health. Maybe you have a condition that you, have been struggling with that you would like to speak to somebody about. I would be happy to do a discovery call with you. They're 15 minutes long. So I can, if you want, I can send you the link for those.
Oh, yeah.
And see if, at this point, it's a good fit for you to work with me as either a coach or as the physical therapist. I do see people in person, but I also do coaching online. So absolutely. And I also do intimacy coaching as well. So if anybody is interested in any of that, you can certainly reach out to me on pleaseme.online. There's a contact section, and that goes directly to my email. And I answer all of my emails every day. So you'll hear back from me there. Yeah. And again, there is no shame in having a sexual health condition. So if that's you out there and there's something going on, seek help, because there is help available. And if you wait until it's so severe, you're going to have less of a likelihood of it improving enough. So you really want to try to think about prevention, and in the early stages to really go get help as soon as you start having any issues.
It's a great point. I also know you do have a Facebook page or a Facebook link and an Instagram link. Are you active on both of those? Pretty active on those?
I am. And if you go to the contacts page on my website, all of my links to all of my socials are there. So you can go to the contacts page and follow me on whichever socials you like to follow. I don't usually give that out because I like people to go to my actual website.
Okay.
So
Understood.
But there is all of the links to all of my socials if you want to follow me on any of those as well.
All right. Because then there's also YouTube and TikTok. So I also wanted, there's also
and
video streaming platforms.
Yes, I do have a YouTube page, and I also am on Spotify, and Spotify has the video aspect. You can do video or audio. So on Spotify, you can do both video and audio, and then on YouTube, you can also find my show in video and audio.
Cool.
So any of those places, you can find me, follow me, subscribe, leave a review. That's how we grow.
Yes.
Leave a review to this show, which I will be doing.
Thank you. Thank you. That's awesome. Cool. I am first of all, I'm just glad, we've spent a couple of hours together now.
I know.
I'm so glad I got the chance to talk to you again. You're so vivacious and genuine, It's very attractive.
Thank you.
You're such a wonderful person. I don't know. I'm proud to be your friend. I don't know how I want to put that.
Me too.
Thank you. It's cool. You're just a good person. Thank you for doing the work that you do. And thank you for everything. Thank you for coming here too. That's been huge. So
yeah, thank you for inviting me on the show. I'm very happy to be here and share with your audience.
Yeah. All right. Well, let me do my little standard shutdown. So let's see. I'm Dr. Amethysta Herrick. I was speaking with Eve Hall, primarily about sexual health and wellness, but also some relationship stuff as well. Usually I like to have a punchy little thing at the end, and I totally forgot. There was something that I was going to use, and I completely forgot it. We had a good laugh in the middle of the show that usually I would take that and stick it at the end, and I didn't write it down because I was too busy enjoying my time.
Having fun.
Yeah. So everybody, you don't get a punchy end, but thank you very much. I guess. Thanks again, Eve.
Thank you so much.
Bye.
It's been a pleasure.